since it's an anatomic defect in the abdominal wall, it's really not going to close on its own. We found over the years that the best way to repair these defects in the abdominal wall is by separating the layers of the abdominal wall on either side, bringing all those layers back together in layers, and then reinforcing the abdominal wall with a piece of mesh that is in between the layers of the abdominal wall. There's several advantages to that. One is that in that separation of the components, we release tension on the abdominal wall. So when we bring it back together, it has as little tension as possible. And then we reinforce that with a piece of mesh because no matter how well we close it, that area is always going to be a natural weak point. We really need mesh to reinforce that. Now, when we place that mesh in between the layers of the abdominal wall, the tissue can grow into it from both sides. And that strengthens the entire abdominal wall. And also that mesh gets its own blood supply, so it's very resistant to infection. The other thing is that that mesh is totally isolated from the bowels underneath, so it won't interact with your intestines at all, which has been one of the issues that we've seen with meshes in the past. And it's also totally isolated from the skin above, which is a source of infection as well. And so we find that if you use the right mesh in the right location, we have really, really good outcomes. Now we're able to do all that dissection and all that reconstruction using the surgical robot. And that reduces pain substantially. And we've taken a surgery that used to be a 3 to 5 day stay in the hospital, and now it's an outpatient operation. So even after all that work, all that dissection, all that reconstruction, patients go home the same day from their operation, which is huge. Usually within a month or two, patients are totally back to all their normal activities. And ultimately, my goal is to get patients back to all the things that they love, playing sports, even exercise and weightlifting and things like that. Here at Mission Health, we're really able to provide cutting-edge care for hernia repairs. The techniques that we're talking about really have only come out in the last 3 to 5 years. So this is brand new, cutting-edge stuff, and really impressive to have that available to patients here in Western North Carolina, right close to home.